sure you do your full hours of dialysis. Never try and rush it. Have a balanced diet, exercise regularly, and I think, just in life generally, you should do as much as you can for yourself. And, we can't choose our parents, but I think you can hope that you have the right genes, because they do make an enormous difference. Next slide, please. So, was it worth it? This is a few years ago, before I became bearded, with my grandson Cain in Ireland, when he's now 16, and this is when he was a smaller boy. And I think these words of Winston Churchill are quite useful to look at. A pessimist sees the difficulty in every opportunity, and an optimist sees the opportunity in every difficulty. Next, please. So, of course, I'd like to thank many people I've listed here. I don't need to go through them all, but they've all been absolutely essential to my getting through the different hurdles, especially my family. Next, please. And I would like to thank enormously again the TANKER Foundation for inviting me and for your important work in helping kidney patients. And I borrowed some words from Mahatma Gandhi: we must become the change we want to see. Thank you very much.
Thank you very much, Dr. Robin Eady. We are going to turn on the lights now, so in case we would like to have a 5 to 10 minute session, question-answer session. So please come out with your questions, because I
would like to know whether you're still on immunosuppressives, steroids, even after such a long time after the actual transplant, and what are the problems you really faced, and how do you really tackle them?
Thank you for the question. I don't know if everybody heard it, but am I still taking the immunosuppressants for my transplant? And the answer is yes. I still take them religiously every day, morning and evening, the main one being cyclosporin. And the dosage has dropped considerably. It is now less than 2 milligrams per kilogram per day. I'm also on a very small dose of steroid, and I stopped taking azathioprine after I had a lymphoma. And the medication does have side effects. For me, it's caused some muscle weakness and quite severe cramps at times. But I think I'm able to put up with these, knowing that it's a small amount of discomfort compared with the benefits. What's so interesting is that in my own hospital, Guy's Hospital, one of our professors is working on what we call tolerance, so that it seems that some patients who have been on immunosuppressants for many years can do away with them altogether. And I think this is probably partly genetically based, and for other reasons we don't fully understand. But it'd be a wonderful step forward if, for all patients, long-term patients like myself, we don't have to take any medicines as immunosuppressants because of the side effects.
Thank you very much.
I'm Dr. Krishnan-Ang. I'm basically a neurosurgeon. I'm here because of my son. My son is 15 years old today, and he was born with trace of just kidneys, and he was treated to be suffering from sort of congenital renal problem. And thanks to Dr. George Abraham, that he's alive today, and it is because of his inspiration that he has seen through all these days without much of a problem. And now the time has come that he has to have a transplant. And just now I had a talk with Dr. George, and he said we'll have to plan that shortly. I would just like to know if there is any diet regime that you follow. Any diet regime that you follow?
I think if you take cyclosporin, there is a tendency for the blood lipid levels to rise. And I think, irrespective of whether you're taking cyclosporin or not, you should watch, especially not necessarily your son's, who's a young person, but at my age, you should be very careful not to eat too much of the wrong sort of fats. So I try and restrict that, and in fact I did take statins until very recently. Other people who don't know this, statins are medicines which tend to lower a fat called cholesterol in the blood. But unfortunately they also have quite marked side effects, including muscle pain and muscle wasting, and I had this problem and stopped taking them. So as a result, my fat level has gone up in the blood, but I have no wish to take the statins again. But for a young man, I think a good balanced diet, the same sort of advice you would give to most people. If his renal function is below par, then of course he needs to restrict, as Dr. Georgi would advise, his sodium and his protein, and particularly the potassium, which can be dangerous if it gets high. I'm sure you're very well advised anyway.
Thank you.
Dialysis, that whether she can be transplantation is possible or not?
Transplantation with somebody with SLE, is that the question?
Yes, SLE problem actually, because of that, whether she can undergo transplantation or not?
Well, I think that again, the first-line treatment for systemic lupus erythematosus would be immunosuppression, and sometimes with cyclophosphamide. It depends on the patient. I think it is possible to transplant a patient, but there is a risk, of course, that there'll be other organs affected with SLE. But it doesn't. I don't think it totally rules out transplantation. But it's something that needs to be discussed with the medical team about because each patient is different. But it's a more of there is an added problem compared with somebody who hasn't got SLE, which of course can affect different organs in the body. Yeah.
Otherwise, how long she can go for dialysis? Actually, she is.
There are some patients I've heard of with SLE who've been on dialysis for, I think, more than 20 years.
There is no problem?
I think so long as the active problem of SLE is kept under check, it can be okay, but it depends a lot on the background disease problem. This is a rare, what we call an autoimmune disease, systemic lupus erythematosus. So I wouldn't say there was any specific problem. It's been done, but I think there are other things that need to be noted.
Okay, thank you.
Yeah.
It was a very nice lecture, Doctor. Thank you very much. I've got one question for you, not related to any free advice. Sorry, I forgot to put it directly. What is the relationship between alcohol and kidney? I mean, Tamil Nadu, one side, it's got a love-hate relationship with alcohol. Everybody loves alcohol, but everybody hates it in public. In public, they all make this, they've got a huge, I mean, it's a very, what should I say, like everybody hates their grandfather or their mother. It's a love-hate relationship that goes on here.
With alcohol.
Now, I have, alcohol is a very broad spectrum.
Yes.
You got all kinds of alcohol, you got very light wine,
Yes.
and you got beer, and you got
Yes, yes.
going all the way up there.
Yes. Well, the interesting thing is that if you have good kidney function, alcohol is cleared from the body quite quickly. But the main organ which is affected might interfere with their medication and cause a lot of problems, especially to the liver.
Any age limit to have the transplant?
I'm sorry?
Any age limit to have the transplant?
I need to hear that
Age
picture.
limit. Is there any age limit for the
Any
transplant?
age limit? You know, this is something which I don't think there's any firm line, because the problem with age limits, you're dealing with chronology, not biology. And we all know that some people who are aged 80 have minds and bodies of people of 50. And therefore, if they're otherwise fit, I don't think it should be necessarily an exclusion. However, some people at age 50 have minds and bodies of people of 80, and you have to think whether they should be able to have benefit from, whether they would be able to put up with it. So I think the question should be more about the general biology, health of the patient, rather than the age. And this is one thing that many of the people who are fond of statistics get terribly wrong. They think that you need to deal with numbers and ages rather than individuals. So I personally feel there should be no age limit, but you have to take the person's ability to deal with the treatment, to deal with all the things that go with the treatment on board.
Well, just for the statistic, just for the statistic, I'd like to just ask you, are you the oldest living person after dialysis?
Well, a colleague of Dr. George's, Dr. Chris Blagg in the States, who trained with Dr. Scribner, who started it all, tells me that I am the longest surviving patient in the world. So. Of course, I'm very grateful. I don't know if I'm proud, but I'm very grateful.
After this program, before the next one at 7 o'clock, we can interact with him on a one-to-one basis and ask him all the questions that we want. Thank you, Doctor. I think we have to give Dr. Robin Eady a big hand for coming here, being with us. And of course, we're going to have to answer the 1,001 questions later. I now request our advisory member and medical director, Dr. Suresh, who will very quickly run you through what is happening at TANKER. Because some people would like to know where we are at, how we start, and what's happening in TANKER.